there for a few hours, his blood pressure drops and he goes home. No, we're not talking about that. We're saying that a controlled patient, that is one who's able to reach and maintain his low blood pressure, that means continuous care, guaranteed medication, teamwork, and comprehensive management of their cardiovascular risk so as to increase their life expectancy, free of events, and a healthy lifespan. That's why our standard for this strategy is to reach the objective of at least 80% of individuals diagnosed with hypertension and undergoing treatment at PHC, implementing Heart's Achievement, and maintained blood pressure levels within the recommended targets. This helps close the equation that we talk about of achieving 80% of access and diagnosis and achieving 80% treatment and achieving 80% of maintenance amongst the treated, controlling their blood pressure. Here, you're going to see a slide that's similar to the preceding one, but here we're no longer looking at access to coverage, but the quality of the care, the control. In dark green, you have the patients who receive treatment and are properly controlled. And then in lighter green, you have those patients that do not have quality health care. And that's how it has to be looked at. Now, here, we see only 2 countries of 36 in the region have figures above the 70%, and above the 80%, only Canada reaches that standard. The average for the region is at about 60%. And here I'd like to appeal to countries to improve the quality of their records and the data analysis. Why? Because the average for the region is above 60%, and yet we get reports from health centers that have control rates of less than 30 or 25% coverage. So, or treatment. If we didn't do anything, statistically speaking, we would have 60% of our patients that have been identified under treatment. But how can therefore you have countries that report only 20 or 25% control? In other words, we need information, an information system, but we also need quality care that does emphasize data, because if we have the wrong data, we're not going to be able to move in the right direction. And there's just I think we can, let's look at this a bit, because I know that right now when we present the next slide, where people are going to say, nobody's asking for 60%. We already have 60% in the region. But the problem is, look at the numbers there. 4 of 36 countries exceed 60%. So there are 4 of 36 that are on that path, but there's 2 of 36 that exceed 70%. But most, 19 of 36, have more than 50% control. So we're not going to lower the control level at the national level to please somebody else. Remember the Society of Mutual Praise. We're not going to lower a standard for people to qualify and be able to join the Olympics. If the problem is the data, it's time for you to think about this. Maybe your denominators are wrong. Well, if they're wrong, then you have to fix them, because otherwise it's the same thing as going with you don't know with the gasoline gauge in your car, you know what kind of pressure you have in your tires, or if you don't know how airplane how to drive a plane if you don't have a dashboard. And so you can't use that as an excuse. You need to have the data, and maybe you must realize that there's problems with the data. Now, there's no doubt that there's a problem with access. There's no doubt there's a problem with quality, because if we don't do what we have to do, and we're having a great deal of work trying to move forward, then how can we not realize that we have to focus on data? We have to improve our data. The verifiable indicators here have minimum cutoff level of 50%. But what we're hoping that most countries will be able to implement this very modest goal of having 50% of their patients improve the quality of care and having their patients under treatment. But the aspiration is to reach 80%. Why? Going back to this 80%, 80%, 80% means it would give us more than 50% of control at the population level. And as I said in the first slide, if we want to have impact on mortality and morbidity and the burden of disease and a significant level in the country, we then have to increase